Junior doctors in England are likely to follow other health workers and go on strike in March. The NHS Confederation says continuing strikes can threaten to stop the health service getting back on track and maybe putting people off for seeking treatment.
With every walkout in each part of the NHS, a warning that under the surface damage is being done.
We've been pushed into a corner that we did not want to be in.
Despite strikes further straining the system, junior doctors like Arjan, expected to vote for industrial action, insist it's necessary.
These patients 3 or 4 years ago, if we'd seen them, we'd have treated them, they'd have gone home, they'd have experienced wedding anniversaries, birthdays, grandchildren going out, Christmases. Now they come into a hospital and it's the last thing they do because there simply isn't enough of us there. And if they say that they want to restore the NHS as they do, then it starts with restoring the wages of the professionals that work in the NHS.
A new survey of junior doctors shows 7 in 10 say they always or frequently work in understaffed rotas. Around half described their desire to work in the NHS in the next year as low or very low. 7 in 10 also say they've worked in the last 3 months despite not being well enough. It's another emerging and unsurprising picture of low NHS morale amid a wider staffing crisis, with many healthcare workers having moved abroad or considering doing it for what they say is better pay and conditions. But on top of that, also concern over what impact further strikes will begin to have on the NHS backlog and its recovery. And so, calls for more meaningful negotiations.
That recovery in terms of operations, getting urgent and emergency care back on track, that is jeopardised if we continue to see these strikes unfold. The public needs to come to the NHS if you have got a problem, because otherwise those issues get stored up in the community.
A government spokesperson said they're open to talks, stating, "We've been clear that supporting and retaining the NHS workforce is one of our key priorities, and that includes junior doctors. Their pay will increase by a cumulative 8.2% by March 2023 as part of a multi-year pay deal, which also invested an additional £90 million to provide the most experienced junior doctors with higher pay." The foreseeable looks to be strike-filled, and this week the most disruptive of NHS walkouts so far. Adele Robinson, Sky News.